It's my feel-good breakfast show.
Welcome back to your Feel Good Breakfast Show, Expresso. And on Tuesdays, we discuss all things health. And as South Africa rolled out the national COVID-19 vaccine program in February this year, this program aims to vaccinate 40 million citizens. Since the month of February, nearly 270,000 vaccines have been administered. What is the next step, you might wonder, in the coronavirus rollout plan in South Africa? And with decreasing numbers, can we still expect a third and fourth wave of infections? Well, we have medical doctor and public health medicine specialist, Dr. Kerrin Begg. She is here to help give us a little bit of an update on what is happening around COVID-19. You're welcome to call us. Our number is 021 110 5552. If you have any questions, Dr. Begg is here to also answer them for you. It's so good to have you on the show.
Thank you so much. Thanks for having me.
Dr. Begg, let's start here. Let's start at the top. What are the stats looking like in South Africa at the moment?
So at the moment we're in the lull between waves. So we're looking around the same as we were looking in September, October last year, which is good.
Yeah.
But I think that what we need to remember is not to become complacent. We are still having COVID transmitted, we are still having COVID admissions, and we are still having COVID deaths. We're just not having them at the same kind of pace as we were seeing during the second wave. So we really must not become complacent.
Yeah. It's not over.
It's not over.
It's not over.
Is it possible still for us as we are right now to avoid entering the third wave, or is that a given? It's going to happen?
It's likely to happen, but we certainly can control the amplitude, the size of the wave, and the duration of the wave. And the most important things that we can do to control the size and the amplitude and the duration of the wave is making sure that we don't spread.
Okay.
So we wear our masks, we sanitize, we wash our hands, and we stay distant from each other. We don't congregate. Those are still our most important mechanisms.
Yeah.
And obviously vaccination is exciting and is another tool in our toolbox, but it's not the silver bullet. So it's going to make a huge difference, but on its own is not going to stop the third wave or any subsequent waves.
Well, everywhere else in the world, maybe not everywhere else, but most parts of the world, I suppose, that have some level of development, you would expect, have already started rolling out the vaccination program broadly to their citizens. And in our country, obviously, we are very much in the backlog where that is concerned. Am I correct to say that as it stands still, the vaccination program is still only for frontline workers? And how many of them have been vaccinated?
Correct. So at the moment, we're still in phase 1, which is healthcare workers. And we have vaccinated 269,000.
Out of how many? Sorry, doctor.
Out of 1.25 million. So we've still got a way to go. So we still have about 1 million healthcare workers to go.
Wow.
So we are a little behind, and we were set back by the AstraZeneca trial results that came out, that then we decided to we were so excited when AstraZeneca arrived. And those have obviously moved on, and we're now with Johnson & Johnson, and I'm absolutely delighted that I got my vaccine 2 weeks ago.
Dr. Begg.
So I'm absolutely delighted. But, it doesn't help unless we're all vaccinated. And I think that that's one of the things around the world, is that we really are needing to have, all of us need to be protected in order for all of us to be protected. So it's one of those things that it only makes a difference when it's done en masse. And so we're really looking forward to the rollout into phase 2, which hopefully will be starting soon. So one of the other exciting things that happened over Easter, a gift to us, is that the Johnson & Johnson vaccine, which is what we have been receiving as healthcare workers, as a single dose, has been given the green light by SAHPRA to be issued as emergency. So up until now, remember that the workaround that we had when we couldn't use AstraZeneca anymore was to use it as a trial, as an extension of the trial.
Okay.
But now we actually actually have it in that we can use it in exactly the same way that AstraZeneca was going to be used.
Wow.
So that means practically that it's just the logistics are much easier for us to administer.
Yes.
And that we can still now start to really hopefully ramp up the rollout and get those doses going.
Good
And I think
news.
that is in the pipeline,
Yeah.
especially given what's happening in Gqeberha with Aspen investing all those billions. So we will be continuing this conversation. So if you have any questions around COVID-19 and especially the vaccine rollout, you're welcome to contact us. That number is on your screen right now. Or you can head on over to our social media pages with your questions. We have Dr. Begg with us for a little bit throughout the morning.